Hello everyone, welcome back to our channel, Microbe Academy. Today, we will discuss an important topic in medical parasitology, blood and tissue flagellates, especially Leishmania donovani, the causative agent of visceral leishmaniasis or Kala-azar. In this video, we will learn about the morphology, pathogenesis, laboratory diagnosis, and prevention and control of the disease caused by the Leishmania donovani. Okay, now let's learn about the blood and tissue flagellates. Blood and tissue flagellates belong to the family Trypanosomatidae, class Kinetoplastida, and order Trypanosomatida. The family Trypanosomatidae consists of 6 genera, among which the Leishmania and Trypanosoma are pathogenic to human. Species of this family may exist in 2 or more forms. Now let's move to the Leishmania. The genus Leishmania is widely distributed in nature and has number of species which are morphologically similar. Leishmaniasis is a group of parasitic disease caused by the protozoa of the genus Leishmania belonging to the family Trypanosomatidae. The most severe form is visceral leishmaniasis caused by the Leishmania donovani, and leishmaniasis is transmitted to human by the bite of infected female sandflies, and distribution of leishmaniasis. Based on the distribution of leishmaniasis, it is divided geographically into the 2 forms. Okay, now leishmaniasis is divided geographically into 2 major groups, that is Old World leishmaniasis and New World leishmaniasis. Old World leishmaniasis occurs in Asia, Africa, Europe, Middle East, and the major species includes the Leishmania donovani, which is endemic in the South Asia, including Nepal, Africa, Latin America, and Leishmania infantum, Leishmania tropica, Leishmania major, and Leishmania aethiopica. And these are transmitted to the human by the bite of the female sandfly of the genus Phellobotomus, while those of the New World Leishmaniasis occurs in Americas, and the most important species includes the Leishmaniasis jagasi, Leishmania mexicana complex, Leishmania brasiliensis complex, and these are carried by the sandflies of the genera Lipchomia and Psychodophagus. In the general term, the New World referred to the Americas and the Old World is used for the rest of the world. Okay, now let's learn in detail about the Leishmania donovani. Talking about the history of Leishmania donovani, in 1900, Sir William Leishman discovered the parasite while examining the spleen smear of a soldier who had died of Kala-azar. The soldier had contracted the disease at the Dum Dum near Kolkata. After a 3 year in 1903, Charles Donovan independently reported the same parasite in the spleen smear of a patient from Chennai. And around the same time, the parasite was also described by Ronald Ross and other researchers in London. Because of the contribution of Leishman and Donovan, the name of the parasite was given as a Leishmania donovani in honor of the Leishman and Donovan, 2 scientists. Moving to the habitat of the Leishmania donovani, it is an obligate intracellular protozoan parasite. It mainly inhabits the reticuloendothelial system, including liver, spleen, bone marrow, lymph nodes, and it is found inside the macrophages and other reticuloendothelial cells. And dogs and hamsters may also act as a reservoir host for the parasite. Now, the morphology of the parasite. Morphologically, parasite exists in 2 morphological forms, that is, omastigote and promastigote. We can see the both form in the video. Here, the Leishmania omastigote form and promastigote form is given in the figure. And we will discuss in detail about each form of the parasite. Okay, now let's learn about the omastigote form of the parasite. The omastigote form of the parasite is the intracellular stage of the Leishmania donovani, present in the vertebrate host and reside inside the reticuloendothelial systems like macrophages, monocytes, polymorphonuclear leukocyte, and endothelial cells. The masticode form of the parasite is non-motile and having a shape of a round or oval measuring 2 to 4 micrometer in length along the longitudinal axis. Structurally, the masticode form of the parasite consists of an outer cell membrane which is delicate and thin and can be clearly demonstrated only in the fresh specimen. The nucleus is round or oval, measuring less than 1 micrometer in diameter, usually located centrally or toward the one side of the cell wall. The kinetoplast consists of a paramecial body, which is the body functions like as a Golgi-like secretory organelle that help in processing, packaging, and transporting the substances inside the protozoan cell and a belliferoplast. The belliferoplast lies transiently or at a right angle to the nucleus, from which a structure called the axoneme arises. The axoneme extends towards the margin of the parasite body and it is represented as the intracellular portion of the flagellum. Alongside the axoneme, there lies a clear non-staining structure called as a vacuole. And after staining with a Zimsa stain or right stain, the parasite appeared as color as a differentiating color structures where the cytoplasm appeared as a purple blue in a color, nucleus appeared as a red color, paravessel body appeared as a deep red color, and the kinetoblast appeared as a bright red color. Now let's learn about the promastigode form of Leishmania donovani. The promastigode form of the parasite is the motile flagellated stage of the parasite and it occurs in the digestive tract of the sandfly vector, usually a genus Phallobotomus, and it can also be cultured in artificial culture media like triple N medium. And this form develops after the parasite enter into the sandfly during a blood meal and have a shape of a elongated and spindle in a shape. And extracellular stage, it is an extracellular stage and measuring 12 to 25 micrometer in a length and 1.5 to 3.5 micrometer in a breadth. The nucleus is centrally located in the body of the parasite and the kinetoplast lies transversely near the anterior end. In front of the kinetoplast, there is presence of a pale staining vacuoles and from the belliferoplast region of the kinetoplast, the axoneme arises. The axoneme extends outward and forms a free flagellum projecting from the anterior end of the parasite. The free flagellum may be equal to the length of the body or longer than the body, but the flagellum does not coil around the body, and therefore no undulating membrane is present, which is the differentiating characteristics of this parasite with the other parasites. And after staining with the right stains after staining with a Zimsa stain, the cytoplasm of the parasite appear as a purple blue in color, the nucleus appear as a red color, and the kinetoplast appear a bright red, giving a flagellum and axoneme of pale purple color in appearance. Now let us discuss the life cycle of Leishmania donovani. The infective form of Leishmania for human is the metacyclic promastigode, which is transmitted by the bite of the infected female sandfly Phallobotomus. And inside the human macrophages, the promastigode transforms into the omastigode form and multiplies. And host involved with the vertebrate host involved the human, which is the main reservoir in the Indian Kala-azar, and sometimes a dog can be used as a vertebrate host. And the vector or the invertebrate host involved is the female sandfly of the genus Phallobotomus, and sometimes the other important vectors includes the Phallobotomus argentivus, Phallobotomus orientalis, etc. Okay, now let us discuss in detail about how the life cycle of the Leishmania donovani is completed. As I already mentioned, the infective form of the Leishmania for a human is the metacyclic promastigode stage, which is present in the sandfly. And the life cycle can be divided into the two stages, that is, human stages and the sandfly stages. The infected human consists of a mastigate form of the parasite in the bloodstream of the human host, or is a free isolator phagocytized formed in a polymorphonuclear leukocytes and a monocytes. When the sandfly takes a blood meal, the female sandfly bites the infected human and injects this mastigotes form of the parasites present in the blood of the human. And the inside the meat gut of the sandfly, the mastigote form of the parasite undergo a development and multiplication, thereby transforming into the promastigote form. And this promastigote form undergo the rapid multiplication, producing the enormous number of the parasites. And after the completion of the multiplication, the promastigote form of the parasite starts the migration towards the anterior goal, where the large number of the promastigotes moves towards the pharynx, buccal cavity, proboscis, and these parasites block the feeding canal between 6 to 9 days after the infection. And during the next bite, the sandfly regurgitates these promastigotes into the skin pore, where completing the sandfly stage. And after the bite of the sandfly, now the human stages start. When the sandfly bite, the promastigote form are regurgitates in the skin wound of the human skin. And these promastigotes form are phagocytized by the macrophages in the skin, and multiplication in the macrophages of the skin inside the macrophages, the promastigote transforms into the mastigote and undergoes the multiplication by binary fission. The infected macrophages now split in the reticuloendothelial systems, where the infected macrophages, together with the mastigote stage of the parasite, travels through the blood to the liver, spleen, bone marrow, and lymph nodes, where the macrophages now become packed with the parasites and ruptures, releasing the mastigote stages in the blood circulation of the human host. When the another sandfly feeding on the infected blood now ingests these mastigote stages in the cycle of the parasite repeat. Okay, now moving toward the disease caused by the Leishmania donovani. The Leishmania donovani causes the visceral leishmaniasis or Kala-azar. The Kala meaning the black and Azar meaning the disease. It is also known as a dum-dum fever or tropical splenomegaly. The incubation periods of the disease generally varies from the 3 to 6 months, but it may be as short as 10 days or as long as 2 years. The general signs and symptoms of the visceral leishmaniasis includes the prolonged high fever, malaise, weakness, headache, weight loss, etc. The parasite spreads from the site of the inoculations to multiply in the reticuloendothelial cells, especially in the spleen, liver, lymph nodes, and bone marrow. This leads to the progressive enlargement of these organs, and enlargement of the organs involves the splenomegaly, which involves a massive enlargement of the spleen, and it is one of the most important signs of the disease. And hepatomegaly, it involves the enlargement of the liver. Lymphadenopathy involves the enlargement of the lymph nodes, and several hematological symptoms are also seen. The skin changes in mucocutaneous leishmaniasis, where the skin becomes the darkened or grayish. The skin changes are often seen on the face, hand, feet, and abdomen. And this pigmentation of the skin gives the disease named as a Kala-azar, which is also known as a black fever. If untreated, the 75 to 95% of the patients may die within 2 years. The most common cause of the death in visceral leishmaniasis is due to the secondary bacterial infections, and this happens because the immune system becomes weakened. Several hematological consequences may arise, where the anemia occur due to the bone marrow suppressions and hypersplenism and destructions of the RBC. And the leukopenia lead to the reduced white cells and immunocompromise, and it opened the door for the opportunistic infections. Similarly, the thrombocytopenia causes the decreased platelets and increasing the bleeding risk. And these three cytopenias leave the patients extremely vulnerable for the secondary bacterial infections. And not the parasite itself is has a high mortality rate, but are the most common cause of the death is untreated visceral leishmaniasis, which is 75 to 95% of the mortality within 2 years. And the visceral leishmaniasis and human immunodeficiency virus together are the synergistic infections because the visceral leishmaniasis it accelerates the development of acquired immunodeficiency syndromes, and presence of HIV infections it enhance the spread of a visceral disease. And similarly, the HIV may either activate the subclinical leishmaniasis or make our patients more susceptible to the new infections. And in some patients, they may develop post-Kala-azar dermal leishmaniasis, where some patients may develop some skin lesions after the treatments, and they appear the hypopigmented macules, nodules, and papules. And post-Kala-azar dermal leishmaniasis patients can act as a reservoir for the infection. Okay, now let's discuss about the diagnostic findings for the detections of the parasites or diagnosis of the disease. Several diagnostic various tests which can be carried out for the laboratory diagnosis of the Kala-azar. And several non-specific laboratory tests can be performed, including the blood count, where the parenchytopenia, mainly neutropenia, and decreased erythrocyte count is seen. And similarly, hemoglobin estimation can also be done for the detection of the anemia, and estimation of the serum proteins, where the raised serum protein with a reversal of the albumin and globulin ratio due to the greatly increased IgG levels. And in the human host, only the during the microscopy, only the mastigote stage is seen upon the microscopic examination of the tissue specimen. The peripheral blood by the thick film method can be used for the mastigotes visualization of the mastigotes. Both the Giemsa, hematoxylin, and eosin stain can be used, and the morphological feature has been already been discussed earlier in the morphology of the mastigotes, since Leishmania mastigote form is morphologically indistinguishable from those of the Trypanosoma cruzi. These are ovoid and measuring 1 to 5 micrometers along 1 to 2 micrometer in a wide, and they possesses both a nucleus and kinetoplast. Needle biopsy aspiration of the lymph node, bone marrow, liver, and spleen can be done by thoughts of the preparation or smear stain with the Giemsa stain for the observation of the mastigote form. And the isolation can be done using a biphasic medium, which include a solid phase composed of blood agar base, known as a and triple N medium, with a defibrinated rabbit blood. And after isolation, the parasite can be characterized to the complex and sometimes to the species level using the isoenzyme analysis, which is the conventional diagnostic approach for Leishmania species identification. And this diagnostic identification of Leishmania using this isoenzyme analysis approach may take several weeks. And the next test can be done is several immunological tests can also be done for the detection of the antibody, and the antibody detection can prove useful in visceral leishmaniasis, but is of limited value in cutaneous disease, since the most of the patients does not develop a significant antibody response. Next method is a molecular diagnosis method, where the molecular approaches have the potential to be more sensitive and rapid, such as the result can be available within a days versus the weeks. And the CDC has incorporated a molecular method in the algorithm for the laboratory diagnosis of leishmaniasis. The method is based on the PCR amplification, using generic primers that amplify a segment of the rRNA, and internal transcribed space 2 ITS2 from the multiple Leishmania species, and DNA sequencing analysis is performed on the amplified fragmented for the species identification, and this approach allows the differentiation among the various species, namely the Leishmania brasiliensis, guianensis, and so on. So the diagnosis can be done by the microscopy, enzyme analysis, isolation of the parasite in a biphasic medium, serological test for the detection of the antibody and antigen of the parasites, and similarly the several molecular diagnostic method can be used for the diagnostic approach of the parasitic disease. And now for the prevention and control of the disease, the preventing and controlling the spread of the leishmaniasis is complex and requires the many tools. And first of all, the early diagnosis and effective prompt treatment is necessary. And early diagnosis and effective prompt treatment reduces the prevalence of the disease and prevents the disabilities and the death caused by the disease, and it helps to reduce the transmission and to monitor the spread and burden of the disease. And there are highly effective and safe anti-leishmanial medicines, which is particularly for the visceral leishmaniasis. And although they can be difficult to use, the access to the medicines has significantly improved. And thanks to the WHO negotiated price, the scheme and medicine donation program through the WHO. And second is a vector control, and vector control helps to reduce the and or interrupt the transmission of the disease by decreasing the number of the sandflies. And the effective disease surveillance is required, where the effective disease surveillance has to promptly monitor and act during the epidemics and situation with a high case fatality and under the treatments and social mobilizations and control of the animal reserve host, and strengthening the partnerships will helps to prevent and control the disease. Okay, to conclude, the Leishmania donovani is an important intracellular protozoan parasite responsible for visceral leishmaniasis or Kala-azar, and understanding its morphology, life cycle, pathogenesis, and clinical feature and diagnosis is essential for medical and microbiology students. And thank you for watching. And if you found this video helpful, please like, share, and subscribe this YouTube channel. And for the more microbiology lecture videos, and if you have any queries or if you want me to upload a video on some topic, please let me know on the comment section. And once again, thank you for watching and see you in the next video.